Welcome to this explainer. If you're tuning in today, chances are pretty high that you, or maybe someone you really care about, has been dealing with an incredibly frustrating and honestly, sometimes terrifying sensation. I'm talking about the room suddenly spinning out of nowhere or a totally unexpected loss of balance. As a medical professional, I really want to speak directly to you as my patient today. I hear you and I completely validate what you're going through. The menopause transition is hard enough with the hot flashes and the mood changes, right? But when you throw vertigo into the mix, it can feel like your entire world is literally turning upside down. But hey, here is the good news. Your symptoms are absolutely not just in your head. They're actually in your inner ear, and more importantly, they are highly, highly manageable.
So, think of this agenda as our treatment plan for today. We're going to cover vertigo versus general dizziness, estrogen and ear health, dietary and lifestyle changes, medical therapies and exercises, and finally, urgent medical warning signs.
All right, let's dive right into Section 1, Vertigo versus General Dizziness.
To make sure we're targeting the right issue, we need to know exactly what you're feeling. So, true vertigo, it's a false sense of motion. It's that unmistakable, super intense feeling that you or the room around you is physically spinning or moving even when you're perfectly still. It usually hits in brief, severe episodes and can be triggered by something as simple as rolling over in bed. General dizziness, on the other hand, is kind of a broader term. It typically feels like lightheadedness, maybe a floating sensation, or just feeling generally unsteady on your feet, like you might pass out, but the room itself isn't necessarily spinning. Knowing which one of these you're experiencing gives us immediate diagnostic clarity, because true vertigo during menopause strongly points us right towards specific issues in your inner ear.
Okay, moving right along to Section 2, Estrogen and Ear Health.
What's really interesting here is just how heavily fluid dynamics in your ear are influenced by hormones. Deep inside your inner ear, there's a fluid called endolymph, and its job is to help your brain figure out your body's position in space. Well, estrogen plays a massive role in regulating the salt and water balance of that specific fluid. So when your estrogen levels plummet or bounce all over the place during the menopausal transition, that fluid regulation gets completely disrupted. This can lead to a buildup of endolymph, which creates this intense, uncomfortable pressure in the ear. This kind of fluid overload is actually a hallmark of conditions like Meniere's disease, and it leads straight to vertigo, that awful feeling of fullness in the ear, and even fluctuations in your hearing.
But it's not just the fluid. We have to talk about the physical structures in your ear too. Your inner ear contains these tiny calcium crystals called otoconia. Think of them as the little physical weights in your internal balance system. Now, estrogen is absolutely crucial for maintaining bone and calcium metabolism. As your estrogen declines, the normal breakdown of these crystals is delayed, so they end up getting abnormally large and structurally weak. Because of this, they can easily break off and migrate into the semicircular canals of your ear. When that happens and you move your head, those rogue crystals send incredibly confusing, chaotic signals straight to your brain. This is the exact mechanism behind benign paroxysmal positional vertigo, or BPPV, which is just incredibly common in postmenopausal women.
Let's get to the actionable stuff. Section 3. Dietary and lifestyle changes.
I always like to prescribe a plate-based treatment plan before we do anything else. First off, we want to aggressively add anti-inflammatory foods, things like omega-3 fatty acids from salmon or chia seeds, plus a good helping of cruciferous vegetables. These are going to help calm down the neuroinflammation in your brain and auditory pathways. At the exact same time, we absolutely have to reduce sensory triggers. And salt is the big one here. If you've got fluid buildup in your ear, salt acts literally like a sponge. You want to aim to keep your daily intake under 1,500 milligrams. To put that in perspective, that's just about 3/4 of a single teaspoon for your entire day. We also need to dial back the caffeine, alcohol, MSG, and aged cheeses. All those can mess with your fluid balance, constrict blood vessels, and totally trigger severe vertigo or vestibular migraines.
But beyond what's on your plate, we have to look at your everyday habits. Menopause often brings on systemic dryness, which absolutely affects your ears. So step 1 is optimizing your hydration, maybe even considering an electrolyte supplement. Step 2 is tackling anything that's causing localized pressure. You see, blocked sinuses or even dental issues can actually cause fluid to back up right into your ear. Using daily nasal rinses or an ancient practice called oil pulling, where you swish coconut or sesame oil in your mouth for about 10 minutes, can significantly help clear out that pressure. Finally, step 3 is optimizing your sleep. Up to 60% of women experience sleep disturbances during menopause, Actually, scratch that. It probably feels like 100% some days, right? But poor sleep seriously impairs your brain's ability to clear out toxins. That ramps up inflammation and makes your inner ear hypersensitive.
Now let's open up the medical toolbox. Section 4, Medical Therapies and Exercises. If lifestyle changes aren't quite enough, one of the most powerful clinical tools we have is hormone replacement therapy, or HRT. Since we know that a lack of estrogen is a root cause of both the fluid imbalance and the crystal degeneration we talked about, replacing those diminishing hormones can have a profound effect. HRT acts to stabilize the fluid regulation in your inner ear, which drastically reduces postural instability. And amazingly, research even indicates that women on HRT tend to have better preserved hearing health than those who aren't. And the clinical research totally backed this up. A prospective study looking at postmenopausal women found that using an integrated therapy, meaning specific hormones like drospirenone and estradiol, combined with physical rehabilitation, was significantly more effective at reducing severe vertigo distress and fluid overload than just doing the rehab alone. The hormones are actually getting in there and helping tackle the problem at a structural and chemical level. It's really a game changer.
Now for BPV specifically, we use a physical tool called the Epley maneuver to literally flush those rogue calcium crystals right out of your ear canals. It is highly effective, and here is a step-by-step tutorial on how you can safely perform this at home. First, sit upright on your bed and turn your head 45 degrees toward the side that's causing the vertigo. Next, quickly lie back, letting your head hang just slightly over a pillow and hold that position for 30 seconds. Then, without sitting up, turn your head 90 degrees to the opposite side and wait another 30 seconds. Finally, roll your whole body onto that side, sit up slowly and keep your head upright. It works wonders. But if you are feeling unsure at all, definitely do this the first few times under the guidance of a physical therapist.
We also have a few other targeted medical options to mention. If fluid buildup is the main culprit, we might prescribe loop diuretics, basically water pills to help drain the inner ear, or a medication called beta-histine, which improves blood flow and circulation in the ear. Vestibular Rehabilitation Therapy, or VRT, is a brilliant exercise-based program that basically retrains your brain to balance itself. And interestingly enough, a lot of patients find immediate relief from chiropractic adjustments. Specifically, there's a technique called a eustachian tube release that can instantly unblock ear pressure, especially if a jaw misalignment is contributing to your symptoms.
Finally, Section 5, Urgent Medical Warning Signs.
Okay, the crucial point here is safety. While menopause-related vertigo is highly treatable, dizziness can sometimes masquerade as a far more dangerous condition. If you ever experience vertigo alongside any of these specific symptoms, sudden hearing loss, blurred or double vision, a thunderclap headache, difficulty swallowing or speaking, or weakness or numbness in your face or limbs, it is a non-negotiable red flag. These are warning signs of a central nervous system emergency, like a stroke, and you must bypass home management and seek emergency medical care immediately.
I really want to leave you with this final thought. It is so easy to view vertigo as just another random, frustrating symptom of getting older. But as we've seen today, your inner ear is incredibly sensitive to your body's endocrine system. So I have to ask, are your ear symptoms just a frustrating mystery? Or could they actually be the first vital clue, like a check engine light, signaling that you need a comprehensive evaluation of your overall hormonal health? Please, don't suffer in silence. Use everything you've learned here today to advocate for yourself, consult with a professional, and reclaim your balance.